Hi, welcome to our poster. My name is Anna, and I will guide you through our team's project. So, dementia affects memory and judgment and can cause high levels of anxiety, depression, and overall lower quality of life for family caregivers. There are interventions that teach techniques for more effective verbal and nonverbal communication with older adults with dementia. Some of them are lengthy and can span as long as 6 months long. Cost and resources are other limitations, especially in the case of one-on-one or small group trainings. Sometimes those trainings are too general or target very specific populations, like nurse assistants. To address those issues, our research team developed a mobile app called Caring for Dementia that provides guidelines on how to respond to difficulties in communication. It includes real-life scenarios that are supplemented with feedback. As of now, we have 56 scenarios, which address aggressive behaviors, anxiety problems, apathy, resistance, and many other issues. Completing a single scenario takes around 5 minutes. When using the app, caregiver is introduced to a situation, as can be seen on figure 1a. Then, let's say, an older adult wants to perform an action. For example, tries to get dressed, cannot go to sleep, or as in this example on figure 1b, asks repetitive questions. At the bottom of the mobile screen, caregiver is provided with 2 alternative response options. If the chosen response is not appropriate or could be improved, the user is provided with corrective feedback and directed to try again, as seen on figure 1c. Alternatively, the user is presented with the positive feedback and navigated to the next step if the chosen reaction is appropriate. At the end, there is a summary that highlights the most important instructions for that situation. The theoretical framework of Caring for Dementia app will be used in future randomized controlled trial, where we will look at the feasibility, acceptability, and effectiveness of the app. It will be compared with the printable and web training materials. We will use 3 questionnaires to assess the caregiver well-being, caregiver burden, and the overall quality of life. Those will be filled out at the beginning and at the end of the 30-day-long intervention. We will also collect usage data to assess feasibility of the app. To conclude, the application is easily accessible and understandable for caregivers, which we hope will encourage potential continued use. Caring for Dementia app is a novel approach that can effectively address the problems in communication between caregivers and people with dementia. Thank you very much for your attention, and I hope you found our ideas interesting.